Hello everyone, welcome back to the channel. So in today's video, we'll be diving into something very important but often misunderstood, dental myths. That's right, I'll be breaking down 10 of the most common myths about the teeth and oral health that people still believe even up to this day. So let's bust these myths and keep your smile healthy and strong. But don't forget to like and subscribe. Let's dive into it. Myth number 1, only sugary snacks cause cavities. Sugar does contribute to cavities, that's a given, but it's not the only cause. Food particles left over after having a meal are huge culprits, especially if they are stuck between your teeth. Dental cavities actually form when the bacteria in your mouth feed on food remnants left over after eating. While they are doing this, they produce an acid. This acid is what over time wears down the enamel, creating a cavity. So apart from your sugary snacks, even foods like your rice, pasta, bread, and meat can actually be risky, especially if they are left over in your mouth and not brushed away. My tip for you is to avoid constant snacking and also make sure to rinse after every meal. This way, you get to remove any leftover food particles. Myth number 2, if your teeth don't hurt, they are healthy. Pain is not always the first sign of trouble. In fact, some of the worst dental issues usually start painless at the beginning. Dental cavities, gum disease, and infections usually start out painless at the beginning and can progress quietly until they reach a more severe stage. By then, the prognosis may not be favorable. One tip is to schedule regular dental checkups. This will actually help to catch silent problems early before they become painful or expensive. Myth number 3, brushing harder means you clean better. For this one, there are many people on this table and I can see all of you. Do you believe that brushing your teeth harder actually means that they get cleaned better? Let me know what you think in the comments. But you know what? I completely get it. You want your teeth to sparkle, and that's a good thing, right? But the thing is, brushing hard can actually cause more harm than good. With forceful teeth brushing, two major things can happen. You can wear down your enamel. This is called abrasion. Or you can have gum recession, which leads to root exposure, and this can lead to teeth sensitivity over time. So you see, more pressure does not mean better clean. My recommended tip is to use a soft bristle toothbrush and very minimal force by applying gentle circular motions. Also, please be patient when brushing your teeth. Spend at least 2 minutes brushing and try to be present in the moment. That way, you are more mindful. Myth number 4, if you brush, you don't need to floss. Flossing should not be optional. It's a very important step and a lot of people miss this. Your toothbrush only cleans the surfaces of your teeth, which is the chewing surface, the front and the back. But it cannot get between your teeth, those tight spaces between your teeth. Your toothbrush cannot get in there. That's where dental flosses come in. They are designed to slide between your teeth to remove bacterial plaque and any leftover food particles. So you see why it's important to floss. It is recommended to floss at least once daily, especially at night. But I will also recommend that you have this handy floss picks with you on the go, especially if you have food stock after your meals during the day. Myth number 5, mouthwash can replace toothbrushing. This one is a big no. The only way to remove plaque from your teeth is by manual labor. Seriously, even with your electric toothbrush, you use your hand to move it around while it does its work. Mouthwashes are simply an addition to your oral hygiene routine. They can help freshen your breath and also help to reduce the bacterial load in your mouth. But it doesn't remove dental plaque and food particles because it doesn't scrub away buildup like a toothbrush would. My recommended tip is, if you like to use a mouthwash, please stick to brands that are alcohol-free because alcohol has a drying effect on the mouth which can predispose you to dental issues. Myth number 6, baby teeth don't matter. They'll fall off anyway. I've heard this countless times, but this is very wrong. Baby teeth do matter, and just like adult teeth, they are essential for chewing, speech development, and also guiding the permanent teeth into proper occlusion. Just because they are temporary doesn't mean that they are not important. Neglecting the baby teeth can actually lead to dental cavities, infections, misalignment, and even damage to the developing adult teeth, especially in cases of abscesses. My recommended tip is, it is important to teach good oral hygiene habits early. A child who brushes well becomes an adult who brushes well. So take notes. Myth number 7, whitening ruins your teeth. For this, I think it's important to check what type of teeth whitening are we talking about and what is the state of your teeth. Unsafe teeth whitening hacks like some DIY methods using a combination of harsh components, can damage your enamel, especially when used incorrectly. But professionally approved teeth whitening and dentist supervised over-the-counter kits are safe when used correctly. However, if you are someone who already has sensitive teeth whitening may not be a good choice for you. A tip for you is, before starting any teeth whitening routine, please consult with your dentist to be sure it's safe for you. And if you want to have your teeth whitened, I would recommend that you have it done professionally by a dentist. Myth number 8. Gum disease only affects your mouth. Gum disease actually starts in the mouth, but it's also been linked to internal health issues. Inflamed gums can allow bacteria to enter into the bloodstream, and this can impact other systems of the body like the heart, causing inflammation and damage of the heart and the blood vessels. If you have an existing health issue, your oral hygiene needs to be on point. Treat bleeding gums seriously, maintain healthy oral hygiene habits, and make sure to visit your dentist regularly. Myth number 9. If your gums are bleeding, you need to stop brushing. This is actually the opposite. Bleeding gums usually mean inflammation, and so if you stop brushing or flossing, you may actually make it worse. When your gums are inflamed, there's usually a space that forms between the gum tissue and your tooth. We call that a pocket, and that pocket allows more accumulation of dental plaque, which will eventually make the inflammation worsen. So you should continue cleaning gently, focusing on improving your technique and consistency. One tip is to use a soft bristle toothbrush with gentle pressure. Making sure to also do a warm salt water mouth rinse multiple times a day for about a week. But if the bleeding persists, please make sure to visit your dentist for a proper evaluation. You could have some tartar or calculus stuck underneath the gum, which can only be taken out by deep scaling. Finally, myth number 10. You only need to see a dentist if something hurts. Prevention is better than cure, right? Let me ask, how many of you have actually been to the dentist? Like seriously, let me know in the comments below. And if you have, when was your last dental visit? Regular visits to the dentist actually help to catch dental issues early before they become painful or severe or even require more complex treatment. Waiting until it hurts actually means that the situation is already quite serious. And if you are trying to avoid a tooth extraction, you need to take this point seriously. A recommended tip is to schedule regular dental checkups every 6 months, even if everything seems fine. Just the way you go for your medical checkups, please do the same for your teeth. So how many of these myths do you believe, and how many are you guilty of? Let me know in the comments. I promise, no judgment. And with that, we've come to the end of this video. If you found this helpful, please share with someone, and don't forget to like and subscribe for more dental tips and tidbits. Until next time, keep smiling and brushing. I'll see you in the next video.